I do feel great. Sometimes I feel as if it never really even happened.
It was very, very quick. I was diagnosed in the August time, and then by, I guess, October, I was actually back at work.
I've been a businessman and business, but coming here I've become a more humble person.
I want to talk to you about radiotherapy. Now, I know as far as conversation killers go, that's pretty much one of the best. But if you're watching this, there's every chance that you've had one of those conversations with your doctor anyway. Radiotherapy is not going to kill you. In fact, the opposite is quite true. The trouble is, people have some very funny ideas about radiotherapy. They see it as a sort of microwave oven meets localized thermonuclear reaction with a touch of oxyacetylene welding thrown in. Well, it's none of those. How do I know? Well, mainly because I've been there myself. This is the radiotherapy unit. I've got follicular lymphoma. The doctors discovered it when they did biopsy on a lump that they took out from my neck. Bad news, it's incurable. Not so bad news, it's treatable. Put it simply, the aim is to live with it rather than die from it. We're all different, young, old, rich, poor. So we react in different ways to being told we've got cancer.
Why does this happen to me? Surely this is just something that happens to other people, and then actually realise that you're not special and it can happen to everybody.
It was a terrible shock, just to be told you've got cancer. You know, why me? It was like an exorcist hitting you, and woof.
At the hospital they were really good and answered a lot of questions, but I didn't know what to expect really.
What you don't know when you're having treatment is the large number of people involved in planning your care. It all starts off with a meeting of the multidisciplinary team.
It's a meeting of all the specialists involved, so the surgeons, the oncologists, the radiologists, the pathologists and the nurse specialists. And the case is presented and then a treatment plan is then formulated. Radiotherapy has a lot of the advantages in that it's a localised treatment that can be targeted, and also is that it doesn't depend on tissue planes. So in patients that have, say, inoperable disease because it's too close to a vital organ, radiotherapy then comes into its own because you can deliver the treatment without the significant toxicity that surgery might have in that particular case.
If your cancer is in the head or neck, like mine was, or you've got prostate cancer, for example, your first port of call will be the mould room.
Feeling warmer?
Yep.
Okay, that's a good indication that it's starting to harden up, so you can appreciate it's a quick process. Doesn't take too long to take off.
It makes sure that the patient can lie or be in the same position each day to allow us to accurately deliver the radiotherapy so that it kills the cancer but reduces the amount of toxicity to the nearby structures. Given the complexities and the developments in radiotherapy techniques, most patients now will either have a CT scan or an MRI scan, which is used as part of the planning procedure, so that even though the patients will have had a CT and MRI scan as part of their diagnosis to stage the disease, they will still require to have what we call a CT or an MRI planning scan. And the difference between that is that that scan is performed with them with their mould on and in the actual position that they are going to get the treatment.
Peter Smith needed an operation and radiotherapy after being diagnosed with testicular cancer.
The strange thing was that at that point in time they had to put little tattoo dot marks around the front of my stomach. So I've got one either side, one on the front, which was just to allow the radiographer to pinpoint where they were going to treat.
After his treatment, he's helped to raise money for the Cancer Centre's charity, Charlie Bear for Cancer Care.
This will be probably the final thing that I do for the kind of Charlie Bear side of things, just because I realise now that I'm signed off from the hospital now, so that's the end of that chapter. I got married last year and now we're expecting our first child in October, so obviously a lot of preparing to do, a lot of nappies and things like that to start getting used to, sleepless nights, and I think that I've always wanted to do my bit, and I'll always be there if they ever want anything from me in the future, but I think it's now time for me to start concentrating on the next chapter in my life and my family, really.
I didn't really feel poorly at all, but we decided that every day my mum kept saying it'll be worth it in the end because it'll make you feel better. I didn't even know if it was going to hurt or anything. It sounds really stupid, but you just don't know. But it was okay. It wasn't really that bad. It was more boring than anything else. Nothing's a problem to the girls that work in there. If you're feeling poorly, they'll sort you out straight away.
And whilst the patient is on radiotherapy, they're generally seen at least once a week by a clinician or a nurse specialist so that we can monitor their progress, and generally most of the side effects can be remedied.
Marilyn German was working as a volunteer in the Cancer Information Centre when she was told she had breast cancer. She now helps out there and in the Charlie Bear shop.
And I carried on working as normal. My skin was very sore, but apart from that I was completely fine. No tiredness, no side effects at all. I think I get a lot of pleasure from helping people in this position, talking to them and hopefully helping them to come to terms with their cancer.
15-year-old Kelly Hudson has been doing work experience at a travel agent in Newcastle. 4 years ago, after an accident, doctors discovered Kelly had cancer.
I fell over the handlebars on my bike, and then a bruise come up, and then a lump, and then it started getting bigger and bigger. But at first the doctors thought it was like a blood clot, so I just kept going back because it was getting bigger.
It's just really traumatic time, wasn't it, for everyone?
Kelly's message to people who are diagnosed with cancer is to stay positive.
Just be brave, because you'll come out of it fighting.
Positive attitude towards life, I think, is the main thing I think Kelly's come out with. I know we all have, and that's just our family.
The Northern Centre for Cancer Care is one of the best equipped in the country. It's also got highly experienced, caring and knowledgeable staff.
I decided, even though I've got all the much money I could go anywhere, I came here because I'm convinced that this is the best place to come to, the Freeman.
Most patients, when they actually do come to the treatment and meet other patients, they find it quite reassuring, and actually they're comforted to know that they're not the only ones going through that experience.
We sit down, we talk to each other, we help each other, and we go through the problems together, and we just laugh now, and all of us have come to terms with it, and that's the thing you have to do. You've got to remain positive.
It's so important to be in a positive frame of mind. I think you need to vision yourself getting through it, being strong and plan for the future.
In 2009, she was desperately ill. Suspected appendicitis had actually turned out to be kidney failure, and when she was being treated for that, doctors discovered cancer.
The staff really, really cared. You weren't just a number, you were a person. They gave you all the time in the world to ask questions, to have space to think about things, and all of the nurses, staff at every level were absolutely amazing. Really, really special people.
In a way, when you come to terms with it, it probably changed your life a little. The health service, I can't speak enough of it, and especially this hospital. It's absolutely superb, and they're not just doing it for me, they do it for everyone. The care and attention and understanding is out of this world.
Well, those were real-life people with real-life stories. I hope they've been helpful. But if you do have any questions, and it's possible that you will, there are some very kind people here who will do all their best to answer them. But whatever you're doing, I'll be seeing you.